Guys, this is Mubin. We are talking about the EKG interpretation. This is the first talk in the series of EKG interpretation skills. EKG is a tool of remarkable clinical value. It is easy to master, and the power of this mastery comes in handy in critical situations where the life of a patient may hang in the balance. So this course will enable you to look at an EKG, pick up abnormalities, and potentially start treatment procedures in timely fashion in critical situations. Remember this, in the cardiovascular systems, especially in the cases of evolving MIs or arrhythmias, the time is an important factor for saving the life of a patient or improving the quality of life by reducing the damage. So after studying this course, you should be able to notice potentially life-threatening arrhythmias, developing myocardial infarction, and even be able to pinpoint the damage to heart tissue that has occurred due to chronic diseases like hypertension. EKG has the data for sure. Your mastery of interpretation will determine how well you perform on the hospital floors. So let us get started. Let us master the EKG. So we've discussed the normal EKG before. We'll recap the information here for the sake of continuity so that you know, you have in your mind the waves and the segments and the intervals and the paper's properties so that you can start seeing the abnormalities. So let's talk about these EKG waveforms and segments and intervals. On the waves side, we've talked about it. P wave is atrial depolarization. Atrial repolarization, called atrial T wave, is not usually seen because it is superimposed by ventricular depolarization complex, which has a much stronger electrical potential, and so the atrial T wave doesn't get a chance to show itself. QRS complex is the ventricular depolarization. It is the second set of waves in the EKG. It includes Q wave. When present is the ventricular septal depolarization. Now it is not necessary to see it all the time. R wave is the ventricular depolarization. S wave is the depolarization of the Purkinje fibers. Now there is T wave as well, which is ventricular repolarization, and we have explained this in the past that the T wave for the ventricular repolarization is a positive deflection instead of a negative deflection. Ideally, what should have happened is, if the QRS complex is positive and that is depolarization, then the repolarization should be a negative deflection. However, ventricles have this special case where the repolarization actually goes in the reverse order, and because of that the T wave shows a positive deflection. I don't want to discuss that too much in detail over here. I've done a complete lecture on it, so please, if you're confused about it, check that out. Now on the segments, segment S for segment, S for straight line. So the isoelectric lines or straight lines are called segments. Intervals, interval has a V in it, V for interval, V for wave. Every interval contains one or more waves in it. That is a condition of the interval by definition. So let's talk about some of these intervals. For example, just one exception before, QRS complex is sometimes called QRS interval, and it is really three waves and there is no straight line. So that is one interval that is an exception. Now let's look at the intervals in the correct order. PR interval includes the P wave. It measures the time from the beginning of the atrial depolarization to the beginning of the ventricular depolarization. PR segment, straight line, measures the time from the end of atrial depolarization, so that means end of the P wave, to the beginning of the ventricular depolarization, that means beginning of the QRS complex. So the isoelectric line between the P wave and the QRS complex is called PR segment. QRS complex measures the time of the ventricular depolarization. We talked about it before. QT interval. Interval, it is a second interval in the EKG. It has two waves in it. You can remember it that way. The first interval is the PR interval. Q2 interval is the second one, so it contains two waves in it. What are the two waves? One is the QRS complex and the second one is the T wave. So now you can imagine QRS complex is the ventricular depolarization, T wave is the ventricular repolarization. This interval contains them both. Wouldn't that mean that it measures the time for ventricular depolarization and repolarization? ST segment measures the time from the ventricular depolarization to the ventricular repolarization. It is segment, it's a straight line. So that means end of the QRS and beginning of the T, the straight line, the isoelectric line between these two complexes or the waves is the ST segment. Now some interesting and important QRS complex assessment hints, and what would happen is that QRS complexes normally throw the students off. Second thing that I see is the P waves and their association. So let's talk about the QRS complexes first. QRS complex has a Q wave, that is the first downward deflection. So by definition, any downward deflection before the R wave, which is the upward deflection, is the Q wave. And if before the R wave there is no downward deflection, then there is no Q wave. You cannot pick up any downward deflection and say this is Q wave. Similarly, the downward deflection after the R wave is called S wave. So you can't say that, hey, in the QRS complex the wave, downward wave has to be Q first, and you can't say that after R the wave should be called Q. Before R the wave, downward wave, is Q. After R the downward deflection is S. R itself is the first and only, hopefully only, upward deflection in the QRS complex. It is the QRS, it is the ventricular depolarization. Sometimes, this is important, sometimes QRS complex shows rabbit ears. That is, there are two upward deflections. There is one deflection, it starts coming down and then it deflects upwards again, forming rabbit ears. That if happens, then the second upward deflection is called R prime or second R wave. Now sometimes a QRS complex can all be downwards without any upward deflections at all. In this case, this QRS complex will simply be called QS complex. That is a Q wave downward, S wave downwards, no R wave. Now let's talk about the EKG paper. We've talked about it in the past. Time is measured on the horizontal axis. So horizontal axis is time. One big box is 0.2 seconds or 200 milliseconds. 200 millisecond means one big box will be, how many big boxes will combine to make 1 second? 200 millisecond plus 200 millisecond 400 plus 200 millisecond 600 plus 200 millisecond 800 plus 200 millisecond 1000 millisecond, making 1 second. So 5 big boxes should make that. Now each big box is divided into small boxes. There are 5 small boxes and each small box is 0.04 second or 40 milliseconds in time duration. These numbers are important, memorize them. These are important for checking the rate and rhythm. Now 5 big boxes in 1 second, so how many big boxes in 1 minute? 300 big boxes in 1 minute. The vertical side of the paper measures the amplitude of the EKG. So V for vertical, V for voltage amplitude is that measure. Now one big box vertically is 0.5 millivolts, and of course that means 2 big boxes are 1 millivolt. Why 2 big boxes are interesting? Because most of the time the R wave in the QRS complex is about 2 boxes, a tiny bit above that. So that tells you if the voltage strength is correct in the EKG, or if the leads are misplaced and voltage is higher for some reason, or if there is a problem with the heart and the electrical current is higher, for example hypertrophy or heart being near the chest walls and so on. So just remember, two big boxes make 1 millivolt. Alright, so we'll continue our discussion. Next we'll discuss the strategy to approach an EKG and start observing the abnormalities. Thank you.